Bismillahirrahmanirrahim. Assalamu alaikum. This is me, Dr. Sadiq Ali from Dr. Medical Lecture Academy platform, रावलपिंडी। आप लोगों के साथ आज एक बहुत अहम मीटिंग करनी है एंड दिस मीटिंग इज़ अबाउट हाउ टू प्रिपेयर फॉर FCPS पार्ट 1। ठीक है जी, इसमें हर एक स्पेशलिटी के बारे में हम बात करेंगे कि आई विल लेट यू नो ऑल दैट यू पीपल विल हाउ टू प्रिपेयर फॉर FCPS पार्ट 1 वेरी वेरी इजीली। तो आप लोगों को अगर मेरी आवाज़ क्लियर आ रही है और आप लोगों को आवाज़ आने में कोई मसला नहीं है तो बता दीजिएगा चैट के अंदर कि सर वी आर हेयरिंग प्रॉपरली, ताकि फिर आप लोगों को मैं जनाब स्टार्ट करूं, ताकि FCPS पार्ट 1 की तैयारी कैसे करनी है, किस तरीके से हमने इसको प्रोसीड करना है। ओके जी, इफ़ द साउंड इज़ क्लियर नाउ वी शुड गो अहेड दैट हाउ टू प्रिपेयर फॉर FCPS पार्ट 1। देखिए, एक्चुअली जब भी हम किसी भी एग्ज़ाम की तैयारी करते हैं तो हमारा एक माइंड सेट होना चाहिए। ठीक है जी, अब देखिए इसको गौर से सुनेंगे, दैट विल हेल्प यू अलॉट। अब माइंड सेट क्या है? माइंड सेट के अंदर चार पांच चीजें आप लोगों ने याद रखनी है। सबसे पहले आप लोगों की जो माइंड सेट है वो क्या है? दैट इज कॉल्ड अ पॉजिटिव अप्रोच। कि जब भी आप किसी एग्जाम की तैयारी करें यू हैव टू बी अ वेरी वेरी पॉजिटिव टुवर्ड दैट एग्जाम, कि इंशाल्लाह आई विल डू दैट इन टाइम। मतलब फॉर एग्जांपल इफ यू प्रिपेयर फॉर सम एग्जाम बट इफ यू डोंट नो हाउ टू डू इट यू विल नेवर डू इट। इसका मतलब यह है कि सबसे पहले आपकी जो अप्रोच है वो पॉजिटिव होनी चाहिए, पॉजिटिव एनर्जी के साथ आपको प्रिपेयर करना चाहिए। देयर शुड बी नो नेगेटिव थिंकिंग इन द माइंड कि भाई मैं कर पाऊंगा नहीं कर पाऊंगा। नो, यू पीपल कैन डू इट। आपने अपने आप को ये बताना है, यू हैव टू टॉक विद योर सेल्फ दैट आई विल डू इट एंड आई कैन डू इट। सो द फर्स्ट थिंग इन द प्रिपरेशन दैट इज वेरी इंपॉर्टेंट, दैट इज कॉल्ड अ पॉजिटिव अप्रोच। नाउ नेक्स्ट वन दैट इज कॉल्ड proper guideline. If you don't have a proper guideline you will not come out, for example, through this exam, because proper guideline is the key for exam to pass everywhere in the world. Because if you don't know how to prepare, if you don't know when to prepare, and if you don't know which content to prepare, you will never go through exam very easily. अब यहाँ पे मुझे जितने भी आप लोग सुन रहे इनमें से मेजॉरिटी लोग ऐसे होंगे जो फर्स्ट टाइम एग्जाम दे रहे, कुछ लोग ऐसे होंगे कि जो मिसाल के तौर पे रिपीटर है, जिन लोगों ने एग्जाम एक दो दफा ट्राई की है बट बिकॉज ऑफ बैड लक उन लोगों का शायद ना हुआ हो। बिकॉज ऑफ दैट यू पीपल डोंट हैव प्रॉपर गाइडलाइन। फॉर एग्जांपल now CPSP, they can change the pool, they can change the MCQ pattern, that how you can go for the MCQ। like let's for example, पहले अगर मिसाल के तौर पे 2023 2023 से पहले की हम बात करें तो हम पास्ट पेपर से भी पास हो सकते थे, हम थोड़ा बहुत फर्स्ट एड को टच दे के भी पास हो सकते थे। नो, दैट टाइम इज गॉन। नाउ द CPSP वांट that you people should prepare according to the they want, because they want to be a competent doctor in the country. Now CPSP changed the pattern. Now they changed the pattern, I think 1 year ago, as I know that meeting they changed the pattern. If someone gave the exam recently, so may he or she know that pattern is completely changed, because recently in NRE step 1 exam for FMG also exam is completely different. Now they want the competency, they want that how we know the depth of the concepts. Like for example, just let me know, for example, one topic, like for example just simple topic, that is hypertension. I am just only giving the example that how you can prepare for FCPS part 1, and if you prepare like that you will never ever fail in the exam. For example, in hypertension, let me tell you, for example they give you a scenario. For example, if a patient has for example isolated hypertension, उसका बीपी जो है वो हाई है, आइसोलेटेड हाइपरटेंशन है, ठीक है जी, जिसमें पेशेंट की जो सिस्टोलिक बीपी है दैट इज मोर देन 140 एंड जो डायस्टोलिक है दैट इज मोर देन 90, बट देयर इज नो कोमॉर्बिड कंडीशन। नाउ इफ द क्वेश्चन कैम इन अ मेल और इन अ फीमेल who has isolated hypertension with more than 140 and more than 90, now what they will ask you, best management plan, for example best treatment. Now we are always think about if they give palpitation, if they give tachycardia, the only two things we see in the stem and we can go for beta blocker. That is completely wrong. Now according to the new pattern always, for example, tell If the patient has isolated hypertension, mean there is no comorbid condition, there is no cardiovascular events or no stroke or there is no other diabetes, etc., then you have to only go in stage 1 hypertension, that is called lifestyle modification. You will always encourage the patient for exercise and decrease salt intake in the diet. Now this is the point majority students don't know because they just only rectalization of that MCQ. They just know, for example, Plana book, Dingra book. No, actually you should be a competent doctor. Now CPSP want not rectalization. They want the concept. If you know the concept, you will pass the exam. If you don't know the concept, you will never pass in the exam. Now let me tell you another thing. For example, if the same cases come in the exam, now you people will see the age. Now if they given the age is more than 55 year, that is a cut off age, very important. And if they give a age less than 55, now यहाँ पे अगर वो आप लोगों से पूछते हैं कि अगर एक पेशेंट है उसको हाइपरटेंशन है बट उसका एज जो है वो 55 प्लस है, तो उसके अंदर जो फर्स्ट लाइन मेडिकल मैनेजमेंट हम देते हैं, दैट इज ऑलवेज CCB, कैल्शियम चैनल ब्लॉकर. Now, calcium channel blocker is the drug of choice for antihypertensive property, and if the age is more than 55. Now, which calcium channel we can recommend? Dihydropyridine that act on the blood vessel like nifedipine, nicardipine, etc. But out of all those, this nifedipine is very wonderful work. But if the age is more than 55, then your recommendation should be initially ACE inhibitor or ARB. If someone cannot tolerate ACE because these drug can cause angioedema or these drug can cause dry cough, then you can replace alternatively with ARB, angiotensin receptor blocker like sartan family, valsartan, telmisartan. Now, in CPSP data nowadays in the new pattern, if they say a 62-year-old male presented with headache, वॉमिटिंग, फटीग, बट उसकी 2 ओकेजन पे हमने BP चेक की है और वो हाई है. अब आपने नीचे सबसे पहले देखा कैप्टोप्रिल. अब हमने ये चीज़ रट ली होती है कि यार एक पेशेंट है उसको हाइपरटेंशन है और उसको हमने ACE से ही स्टार्ट करना है. नो, इफ द एज इज मोर देन 55, रिमेंबर always the recommended plan should be CCB, calcium channel blocker. That is the new guideline and new criteria, which is very important one. And this criteria is approved by everywhere in the world, like in CPSP criteria as well as in NICE criteria, National Institute of Care and Excellence. That is according to British nationally formulary criteria. You people should know this. For example, if they say a patient with hypertension and at the same time the patient is diabetes. Now यहाँ पे एक पॉइंट आता है कि यहाँ पे हम फिर एज को नहीं देखते, दैट इज कॉल्ड irrelevant of the age. Now sometime in hypertension age matter a lot. If there is isolated hypertension, we have to see the ages, कि what is the age of that given person. But if isolated hypertension is there and that is a diabetic patient, irrelevant of the age, no matter it is less than 55 or more than 55, then you can always recommend diabetic hypertension that is treated by ACE. Now, ACE inhibitor that decrease the breakdown of bradykinin. So after how long if a patient symptom develop like dry cough or angioedema, that will leads to ACE inhibitor symptom, they take about 6 months time. Never remember, if a patient take ACE inhibitor, it doesn't mean the person will tomorrow develop cough or angioedema. It take almost 6 month time. For example, the later the patient will develop these symptoms. So that is very important point. You people should know about it. For example, if the patient do not show any response, for example you start to a less than 55-year-old patient ACE or ARB out of these two but not respond, it's mean it is not responding, then what will be the next step? Now this is the concept you people should know. You people don't know how to deal these patient. Now ACE inhibitor or ARB if not responding in the patient in hypertension, what is the next step? Remember, you should always add thiazide diuretic. That is very important one. Never go for potent diuretic, that is loop, because that is used for edematous condition like pulmonary edema, etc. We always recommend thiazide, but not hydrochlorothiazide. The best thiazide for this case, which has a least common side effect, that is called endopamide. That is called endopamide. So endopamide, that is one of the thiazide that is best wonderful work in a patient of hypertension when both these agents are not effectively working. Now, if you give thiazide, but still thiazide not response, mean the patient still blood pressure is very high. What is the next step? Now, यहाँ पे CPSV according to the new rule, they demand something special because these type of thing, if you can play with concept, then you can pass very easily. But in FCPS part 1 or JCAT, because 1% matter a lot on the day exam. Now, after that, if they do not respond, what you will see, that is called potassium level. We should go for potassium level to check. अगर पोटासियम लेवल इसी पेशेंट के अंदर दूसरे ड्रग देने से पहले पोटासियम लेवल कम है 4.5 से या ज्यादा है 4.5, दिस इज द कट ऑफ वैल्यू. अगर पोटासियम लेवल लेस देन 4.5 है, then you can try aldosterone antagonist, that is called spironolactone, because spironolactone will spare potassium, that is potassium sparing diuretic. So that is why in this case actually जो spironolactone है ये क्या करता है, ये पोटासियम बढ़ाएगा, but we will keep eye on that potassium do not exceed actually more than for example 6 or 6.5, otherwise can cause fatal arrhythmia. Now, if potassium is more already, if you see that after the, for example, patient with 45-year-old came to you and you start ACE or ERB, remember, and if they not work, so actually after that we eat 8 thiazide diuretic, that is indapamide. After that, for example, if it is not work, then the next step to see potassium level. If potassium level does not work, then we see if it is less than 4.5, then we add spironolactone. But if it is more than zero point 0.5 point, then we do not go for spironolactone due to the risk of fatal arrhythmia. Then we can add beta blocker here. So we can add the beta blocker. Now, if you add beta blocker, but at the same time the patient was diabetic and the same time the patient has COPD or any obstructive disease, we do not give beta blocker, especially non-selective beta blocker, due to the risk of bronchoconstriction in the patient of COPD and bronchial asthma. So we always see this. Now, why I am telling this? Because जिन लोगों ने इसको ज्वाइन किया है ताकि उनका माइंड बने कि व्हाट CPSP डिमांड फ्रॉम यू गाइस, इफ यू कैन गो फॉर जस्ट लाइक कि भाई मैक्सिमम रीअब्जॉर्प्शन किडनी के कहाँ से होती है, दैट इज PCT, वो बच्चे को भी पता है आपको भी पता है. ओके, दे आल्सो आस्क which type of immunoglobulin present in secretion, IgA, आपको भी पता है बच्चे को भी पता है. But if they ask such type of question in the exam, they carry lot of weightage in the exam, and if you know such type of concept, you will never ever fail in the exam. So I think you people should build your concept how to manage such type of cases. Now the CPSP change the criteria and change the MCQs pool, and they try to check your, for example, the best possible concept, that how much you know the concept. If your concept is good, if your concept is very good, you can, for example, go for anything. For example, you can go for anything you want. Like for example, इस तरह के बहुत सारे, बहुत बहुत सारे जो है ना, हमने अभी रिसेंटली न्यू टॉपिक ऐड किए थे CPS वालों को, और हमारे माशाल्लाह 80% कंटेंट एग्जाम में आए थे. तो हमने चाहा कि बहुत सारे स्टूडेंट की डिमांड के मुताबिक कि सर FCPS के ऊपर हम एक प्रॉपर जो है काम करते हैं, ताकि इस तरह की केसेस आप लोग सीखे. सो दैट विल नेवर नॉट ओनली हेल्प इन योर एग्जाम, दैट विल ऑलवेज हेल्प यूर इन इंशाल्लाह करियर एज वेल. तो ये एक तरीका है कि FCPS पार्ट 1, अब आपने कॉन्सेप्ट पढ़ ली फॉर एग्जांपल, अब आप लोगों को मैंने यहाँ पे जो फॉर एग्जांपल इसके लिए जो कंटेंट्स हैं या जो सब्जेक्ट्स है कि हाउ टू प्रिपेयर एंड मतलब विच टू प्रिपेयर, रिमेंबर नंबर 1 इसके अंदर फर्स्ट एड के लेक्चर्स पता होना चाहिए. अब यहाँ पे दो चीज़ें हैं, फर्स्ट एड लेक्चर्स ये बहुत सारे स्टूडेंट करते हैं, बट एट द एंड ऑफ द डे इफ आई आस्क अ क्वेश्चन देन नो बडी कैन आंसर. तो फर्स्ट एड पढ़ना, फर्स्ट एड को समझना, इसमें बहुत फर्क है. तो यू शुड पीपल should not only read that first aid, but you should know the basics of that first aid. For example, in for example microbiology, for example, sometimes they ask a question. Let me just give you the example. A patient presented with non-caseating granuloma, and that is due to cat scratch disease. For example, cat scratch disease, like आप लोगों को पता होगा CPSP before they asking a lot of time what is caseous necrosis, what is caseous granuloma, and everyone know in this group as well, that is tuberculosis. But nowadays they change the criteria a bit. For example, they ask Crohn disease, they ask berylliosis, they ask sometime like they ask different type sarcoidosis, cat scratch disease, they can cause non-caseating granuloma. But after that, they ask which type of microbe is involved in cat scratch disease. For example, if the MCQs has Bartonella henselae, that is very important. Remember, who knows in upcoming exam, those who are going to appear, this will be one of the MCQ, Bartonella henselae. Now, a good student, what should do? Okay, that student will go into the first aid lecture where I discuss this Bartonella henselae in bacteriology. He will read this. Okay, Bartonella henselae can cause cat scratch disease. What other thing this bacteria can do? What is the nature of that bacteria? Either it is gram positive or gram negative bacteria. Now, this type of thing you people should grab for FCPS part 1. That is very, very important one. For example, H. pylori. H. pylori, everyone know that we can diagnose through stool antigen test, urea breath test. For example, now this H. pylori is oncogenic, can cause gastric carcinoma. Now, at the same time, the good student should think if H. pylori is an organism which has the ability to cause cancer, can I know something else which is also microorganism and cause cancer like Epstein-Barr virus, Burkitt lymphoma, nasopharyngeal carcinoma, HBV, HCV like hepatocellular carcinoma, HHV8 that is Kaposi sarcoma, HIV misal AIDS patient. So such type of very important, very conceptual thing you people should know. Don't always follow rectalization system and don't follow always copy paste MCQ. You have to know such type of conceptual thing before going to exam. Now H. pylori, then at the same time the student will think it is urease positive. What is meaning of that? It is oxidase positive. What is the meaning of that? What is catalase positive? What is the meaning of that? And how we can treat this pylori? What is triple regime? What is quadruple regime? Now such type of thing you people should know. So if you study like this, you will never fail in the exam. But what we study, we do not guide by someone, we do not follow by someone. Just we always go for ourselves. No, always remember my two words. हमेशा सीनियर से सीखे और हमेशा जूनियर को सिखाए. When you learn always from the senior, you always learn from the teacher and always teach to the junior, you will be always on the top of the rank and you will never fail in the exam. And इसके बाद number two, high yield points. High yield points mean the question come, they will given the value. For example, like how to calculate cardiac output, how to calculate effective estimated GFR. For example, such type of question, median, mode, arithmetic mean, standard deviation. These are very, very important calculation point. After that, neuroanatomy, neurophysiology, they are the difficult part of FCPS. And I explained those things in my whiteboard lecture recently, and these are 3D lecture that I explain each and everything in that particular area. And after today, I want to do proper work on FCPS, that inshallah, like NRE step 1 recently, out of my 288 students, 262 are succeed in NRE step 2. Maybe someone is hearing me right now, the step 2 students, they also join. Within one day today, we start FCPS part 1 and they join me more than 18 students in one day. And inshallah, those who join us, they will succeed at the end as well. And the third one, that is very important one, that is after every 20 days, there will be a mock test. And you people should keep going to do MCQ on daily and regular basis. For example, which book is best for the MCQ? You are best for yourself. You should take guideline from either one book. If in the market there is Refula, Radiant Note, that is a good book, and SK book, that is a good book, F double A, that is a good book, but what is good for you, that matter a lot. Don't go for SK, don't go for Refula at the same time, because you don't have the time and you will make yourself very confused. If you follow one thing and you follow such a thing that will help you in the exam, that is for you more than enough. So don't confuse yourself like Tanveer notes, ye, wo. No, I am also giving, inshallah, after 1 month, my app will come and that app will contain more than 4,000 MCQ for FCPS, and those who study with us in the lecture and then at the same time go for the same MCQ to practice, they will definitely pass in the exam. So FCPS part 1, Please don't compare this exam with NRE. Don't compare this exam with something else. It has a special requirement. The CPSP want a competitive doctor, competitive student, that how much you know the concept. So one thing, that's hypertension. I gave you the example. I hope you people got it. How to prepare for this FCPS. Like if you people hearing me, and if someone fail last time, one time, two time, he or she may be think that such type of study we never go for it in the last two attempt or three attempt. And if you don't go for same study until unless you do not clear your concept, you cannot go beyond from that exam. So my point of view, just to work on it, just to always hold on the concept. Now the next question, duration. Okay, how much duration is required for FCPS part 1? Always go for a mature attempt. Do not follow immature attempt. Remember, if you do not confident on yourself, taking part 1 exam, appearing in part 1 is very easy, but performing in the exam is not easy. If you do not prepared, if you do not feel confidence, you should not go for the exam blindly, because if you don't study you will never pass. If you study, there is a chance of pass or fail then, and if you study well, you have a good chance of pass, and if you study properly you will be definitely pass. So that is what CPSP nowadays changed from the last 1 year. But majority student, they don't know, they just only follow from the last 10 year, like Plana notes, Dingna notes, Plana MCQ, Dingna MCQ. एक्चुअली एफसीपीएस पार्ट 1 के ऊपर मैं एक्टिवली काम पहले नहीं करता था, तो स्टूडेंट को पता नहीं था। अब एनआरई 1 में मेरे स्टूडेंट 80% इसलिए पास है कि उसमें मैंने एनर्जी लगाई, मैंने मेहनत की, हेल्प की। इवन हमारे गेस्ट पेपर भी 90% आते हैं। सो एक्चुअली द न्यू थिंग्स आई नो कि व्हाट टू डू इन एफसीपीएस पार्ट 1 to pass that exam. But the most important thing, it's all about your energy, how much you are energetic and how much you are think positively for that exam. Otherwise a teacher cannot do anything for you until unless you should not give your own time. So the main point should be, remember, if a person is busy, having a busy schedule, like you work as a GP, you work as a, for example, in the clinic, and you are the only person in the home and you have a busy schedule, so for those people I will recommend to join us for 6 months. If you give a 6 month, you will be the master of that exam. If you give 6 months, you will be mature enough to give in that exam. But if a person is free mean, for example, no busy schedule, मतलब free schedule mean you are very free in the day, in night. You give, for example, minimum 8 to 10 hours. In 3 months, I will recommend for the exams. But exams always doesn't need your hard work. It always need your what answer is tricky and tips points that it will work in the exam. Now exams is made up of three type of MCQ. The CPSP decide, the professors decide, that check on the basis of three things. Number one, if they ask the question which antibody cross placenta, that is always present in the exam. Which antibody involved in primary immune response, which antibody in present in secretion, always come in the exam. These are very super easy question. But if they ask the question क्या का पेशेंट है, उसको मिसाल के तौर पे इरिवर्सिबल ब्रोंको कंस्ट्रक्टिव डिजीज है, and there is a barrel shaped chest appearance, and the patient has CO2 retention, ear trapping, and that lead to respiratory acidosis, then we think about emphysema. That is the question. If you know something, if you read something, you may answer it. Now if their question, if a patient came to you and a patient has an obstructive disease, and at the same time the patient has, you know, this value, I don't know, that is called DLCO. That is called DLCO, DLCO. That is called diffusion capacity. Diffusion capacity of carbon monoxide, that is raises, to which condition you will suspect. Now you have to know why carbon monoxide we can take as a measurement in clinical lab. The answer is it has a great affinity to attach with hemoglobin as compared to oxygen. So in some condition, this DALCO, diffusion capacity of carbon monoxide, is very high, but in some condition it is very low. So that is again a next very important topic for the exam that take about 1 hour to explain. That is just I want to give the example. Some MCQs they just put in the exam just to make you confused for a while. अगर आप एक MCQs को देख के कहे कि यार मुझसे नहीं हो पाएगा, तो मे भी आने वाले 10 MCQs भी आप नहीं कर पाओगे. सो माई पॉइंट ऑफ व्यू, always follow the CPSP new criteria, what to do, what not to do. Actually come to us, join us for FCPS part 1 and pass your exam on first attempt. Thank you so much. Allah Hafiz. At the last, if you people ask something, please you can ask me, I will reply accordingly. And I hope you people will also comment in the group now, you people learn something new from this meeting or not. Ji, anyone ask some question, please? Anyone have asked some question, please, they can ask me. Anyone? I gave you the idea how to prepare for FCPS. Now, if you people, okay, how many students pass FCPS part 1 from you in May, August? Just asking like you share your result of NRE 1, 2. Okay, that is a good question. Actually, last time I teach to about 28 students and out of them, I think 17 or 18 qualified. Okay, but actually as per NRE step 1 and 2, we are taking care of it on the basis, daily basis. So we always go for it. But onward, we also work the same thing like FCPS part 1. So inshallah, onward FCPS part 1, we will inshallah work on it. And those who will come, actually, they will come and they will always contact with us. You can contact with Dr. Shahid, you can contact with me. And FCPS part 1 new session already start. For any type of question, you people can contact me with contact Dr. Shahid. और हमारा व्हाट्सएप ग्रुप बना है, उस ग्रुप के अंदर मैं डेली बेस पे जो इम्पोर्टेंट पॉइंट्स हैं इंशाल्लाह आई विल बी always edit. Yes, pharmacology I treat. I actually teaching the whole MBBS. I teach the whole MBBS, and there is more than 3,000 doctors. They taking lecture with me on daily basis for NRE, for USMLE, and I teach to them for FCPS. So actually, you people can come and you can join us. Okay, first that will give you the clue for the basic. Then our top 80 lecture that I discuss in the board, that will again play a very important role. And if you follow first aid and if you follow our lecture side by side, you do MCQ test, you will be definitely pass in the exam. So that is very important. And some people ask me कि how many hours we can just go for to prepare it. So it doesn't matter the number of hours, what it matter कि what you learn and what you study. मतलब it all about your content of study कि what you study, that matter a lot. If you, for example, if you learn and if you can work very hard but you don't know how to work, you will never pass. Yes, or FCPS classes are purely online. There is a no campus based classes. And the campus based before actual exam, जब 2 हफ्ते रहते हैं तो हम ट्रेनिंग 2-3 दिन की सेशन देते हैं to came here and they can we arrange the test like a real exam at the end on computer in academy. For that reason you people can come at the end of the session for 1 day 2 day, otherwise each and everything will be online. So actually you people should know actually total price and duration. Please you can contact me in the WhatsApp inbox and inshallah I will be help you. Yes, the lecture we will give you, that is in the recorded form, so you can watch anytime you want. For example, if you can watch those lecture in the night, in the day, whenever you have a free time you can watch the lecture, and we will give you a very proper plan how to prepare and how to proceed. So actually I gave you the idea, simple idea, what CPSP required nowadays. Don't they require the ritualization, though they required incompetent doctor. Actually they always required what you have knowledge in the core of your brain. If you have good knowledge, if you have a basic knowledge, and if you have the management technique, you will be definitely go through it. देखिए FCPS में क्वेश्चन बहुत छोटे होते हैं. We will always start and I will cover the neuroanatomy, neurophysiology part very well. Those who will appear in gynae, we will provide them special lecture in gynae. If someone will need ophthalmology, each and every specialty, alhamdulillah, I have the technique and I have the method how to do it. Inshallah, I will help. Yes, those lecture we will give you, that will be recorded and you people can watch those lecture anytime you people want. Let me give you my number if someone don't know. Actually, those who want to take some information, they can, for example, contact me on WhatsApp. There I will be very importantly. I have now a meeting with MRCP Part 1 candidates soon after half an hour. So you people can leave me a message. Later I will inshallah reply. So actually for taking subscription, you people can contact on the given number in fee structure, about guideline, about the topic, how to prepare, how to actually take a start. You people can talk me. If you people can talk me, I will know the depth of your study. If I guess that you are very weak, I will give you the option better to go for February attempt, not November attempt. And if you have a grip and if you have a good idea, then I will discuss that you can go for November and you can join. तो इंशाल्लाह दैट इज़ व्हाट ऑल अबाउट फॉर टुडे। उम्मीद करता हूँ कि आप लोगों ने बहुत कुछ सीखा होगा। अपने दोस्तों के साथ इसको शेयर करें और ये मैं इंशाल्लाह यूट्यूब पे भी कल अपलोड करूँगा ताकि इंशाल्लाह दूसरे दोस्तों को भी फ़ायदा हो। सो थैंक यू सो मच गाइस, टेक केयर ऑफ योर सेल्फ, and that is a great meeting, and inshallah such type of meeting we will arrange with you guys. If you people are interested, then I will also find a time to go for it, and inshallah I will be definitely help you guys, because we are the family. If we help, we can help each other, so we should definitely help each other, because if we help each other, for example I am the senior, so you people can learn from me, and then you people can teach to your student. Inshallah Allah will always give you the reward. So take care of you guys. Let me know in the WhatsApp inbox. Thank you so much. Allah Hafiz. Jazakallah.